Anybody who wants a breast reduction can have one. There's a variety of different ways that we can do the surgery to help you achieve your goal. So depending on what you want and where you're starting, your surgeon will guide you to the right choice. So if you would like a quite small breast reduction, so usually a half a cup size to a cup size, liposuction is a wonderful option. This is a great option as well if you don't have a lot of drooping, because liposuction doesn't lift the skin like a traditional breast reduction will. But if your goal reduction is small, that could be the right choice for you. The type of breast reduction that most women get is a traditional breast reduction using a pedicle. And the pedicle can be a variety of different types, but it's basically just a chunk of tissue that's left behind where the nipple lives. And everything gets removed around it, and then everything is closed into your smaller, perkier, higher breast. The limitation with size with that particular technique is just how much tissue we leave behind to keep the nipple happy. Now, if your nipple is quite low, the pedicle will be quite long, and so more tissue needs to be left behind. So if your size goal is small, you may not get there with that type of breast reduction. So for patients like that, we can do something called a free nipple graft, where we actually remove the nipple and place it back on as a skin graft. And that's a way where the pedicle size can be chosen by us because we're not limited by the position of the nipple anymore. So because of how breast reductions are done, the main limitation is always going to be making people on the smaller side. So if you, like you said, would like to be a little bit larger and you're worried about being too small, that's less likely of a scenario. But again, it's always important to discuss with your surgeon what your goal is so they can get you as close as possible. Now, the other thing that's important to discuss with your surgeon is insurance if you're going through insurance. So you need to make it clear to your surgeon what you want, because if your insurance wants a certain amount, but that's not going to make you happy, you need to make sure your surgeon knows that. And you also need to understand that if that's the situation, they may not cover your surgery, so you need to be prepared to pay for the surgery as a cosmetic procedure. And then always remember, when you're having a breast reduction, if the size isn't what you want when you've healed and you're 6 months out, there's always tweaks that we can do to change it. So if you're a little too big, little too small, little too asymmetric, we can do liposuction, we can do fat grafting. There's little adjustments that can be done to make you happy. It's of course not ideal. We would love to always get it right in one go, but there's always options.